it right. Looks like he hardly has enough energy to ride home. Well, you run him all over the place.
Movement, so fundamental an aspect of life that it's easily taken for granted until the ability to coordinate the muscles of the body is lost, and performing even the simplest task becomes a struggle. For some, this disruption of muscular function is caused by a rare neurological disorder, Dystonia musculorum deformans, or dystonia. It may begin in childhood with the cramping of a hand or the twisting of a foot, spreading to other parts of the body and progressing erratically. Sometimes leaving its victims confined to a wheelchair and unable to speak. Dystonia, a puzzling illness whose symptoms vary from moment to moment in a way that defies medical explanation, in some cases interfering with walking, while having little or no effect on running, often leaving its sufferers misdiagnosed and misunderstood. Susan has had dystonia for nearly 30 years. She was 10 when the disease struck without warning. She'd been a perfectly normal child. It began with a writer's cramp and progressed rapidly throughout her entire body, eventually affecting her speech. Though many of her symptoms have been alleviated through surgery and her speech has in fact improved, Susan is still noticeably impaired.
When people meet me initially without any warning, their immediate response is one of questioning either whether I'm drinking or whether I'm on drugs. It's, again, a combination of slurred speech and an awkward gait. And I suppose if I saw me and heard me, I would assume pretty much the same thing.
Well, Dystonia musculorum deformans is a curious illness. Curious in its
Dr. David Marsden is professor of neurology at King's College, University of London. He is a leading authority on this relatively unknown disease.
It's a disease which commonly starts in childhood, although not always. A number of adults may develop the disease for the first time, really at any age of life, but most commonly it appears during childhood. And when it appears for the first time in a child, it usually starts to affect walking, starting in the legs. Those who develop their first symptoms in childhood are the ones most likely to experience a progression of the disease, to involve all four limbs, the neck, the trunk. In other words, the disease becomes generalized dystonia. These abnormal muscle spasms occur spontaneously, quite beyond the control of the individual. They're involuntary movements. They often occur only on a specific motor act, but as the disease progresses, may occur more and more spontaneously and even at rest. It's difficulties like this, which nearly always leads to them being dismissed as psychological or hysterical in origin to begin with. And treatment, I must confess at this moment, is difficult. There are a large number of drugs that are employed in an attempt to relieve dystonic spasms, and if drug treatment fails and disability is severe, then some forms of surgical therapy may be considered.
Say a word and looking as if I'd already punched her in the nose. I repacked the suitcase and closed it. Half my stuff was still lying around my room, but I guess Dad would come and pick it up for me later. For now, I had enough to see me through a couple of weeks.
Laurie is 11. She has suffered from dystonia since early childhood. However, with the aid of an electronic communicator, she's overcome almost total loss of speech and attends public school.
Dad, Believe it or not, it could be with your sisters and brothers sometimes. Also, what it could be with is your animals. All right, who else can give us another want? Lori? So far, the wants up there, we have some toys and some animals, cars. What else? Closeness, right? Okay, closeness, again, I think possibly could be right here under the love, the closeness, okay? Which category is more essential, need or wants?
That's it. That's it. It's all the dust on, all dirt.
Brett has retained her ability to speak and doesn't appear to be severely impaired. As a 15-year-old, however, she's at a stage of life when being different in any way can be a source of alienation.
It's pretty rough. One of the simplest things that she really, really would like to do is just be able to walk down the street with a couple of her friends and just have a conversation. She can walk for very short periods of time, you know, maybe 50, 75 yards at a time, and that's about it. She can go on her crutches, but she really gets very tired and doesn't want to walk blocks on her crutches. She's probably having her left toes cramped underneath and pounding on them, and they're hurting her, and probably having a lot of pain in her right leg because she can't put her foot down flat, but she's still out there playing and doesn't seem to feel it. She's probably getting tired while she's riding, and she's still pushing herself, and when she gets back, she's pretty well drained. I feel fortunate that at least there's something that she can do and get away from her everyday routine of watching television and pretty much sleeping, because the medication she takes has a tendency to make her tired pretty much all day. And I mean, she starts riding, she's tired from when she gets on the horse until she gets off the horse. But I think that she sort of forgets about that as she's, you know, out on the trail and away from home, or just away from it.
Good. Again. Sherry?
Sherry is 17, a high school senior. With treatment, her condition has improved to the point that she can participate in most activities. But it took many years for Sherry's dystonia to be properly diagnosed. For her parents, it was a long and frustrating ordeal, an ordeal that most dystonia patients and their families must endure.
Well, we started with the pediatrician. When he looked at her, there was no symptoms. The next time, it was another pediatrician. And she said, that was a female pediatrician, and she said, "You're imagining things. It's just a little turning in the foot. It's not there all the time." The third time, the pediatrician, there was another one in the same office. He was the head pediatrician. He told me that she had cerebral palsy. Now, cerebral palsy, to my knowledge, you were born with. There was no problems until now, but never offered anything else but. He just said she has cerebral palsy and walked away.
One thing that comes to mind is an orthopedic surgeon that we went to initially, and the diagnosis, well, I think it's something connected with leg and muscle. And what I want you to do is buy a special shoe and put an attachment in the shoe, and then continuously every night for the next 2 weeks do leg exercises, foot exercises. That went through 2 weeks, and then more x-rays and more tests and additional hardware and software and more exercises, and it was fruitless, did not work. From there, it went to a doctor who thought that it might have been encephalitis. There were so many unknowns, and he was groping in the dark. And these were people that were either neurologists or pedioneurologists. I think that
despite the early difficulties with diagnosis and prolonged absences from school, Sherry has managed to do well academically. She even plans to go away to college next year, though she has a severe speech disability.
Read ahead, 15 pages.
Her sister Beth is one of the few with whom she communicates easily.
She feels sad because when she's at home, like on a Saturday night, she thinks about, you know, the kids that they're out on going to movies and everything, you know, kids her own age, they're out having fun and dating and everything. She wants to, you know, be part of that and everything. Skating today. I wonder what my music's like. It's probably boring, isn't it? It goes okay. Today, we had this English test. It was pretty easy. I think that people are afraid to start making friends with her, and I don't know, they're afraid that, you know, she can't do certain things. I mean, she can if they give her a chance. She could do lots of things, but it just takes a little more time. And people just don't want to, you know, they don't really care.
In order to cope with the disability, you have to know the full extent of what you personally, physically can or cannot do. I know that I can do anything that you can do, probably better. It may take longer. I may not do it as gracefully, but I can do it.
For dystonia patients, there's a constant struggle to find a meaningful place in society, a place where their handicaps are accepted and their limitations are not a burden. Jeff has had dystonia most of his life. Still, despite the severity of his condition, he's managed to compensate for many of his limitations and achieve independence and dignity.
Oh, you're more relaxed, and what did it encompass? I mean, what did it mainly consist of as far as, you know, the... Breathing?
Exercise.
Oh. Jeff has always been very independent. It would have been easy for him to stay here, but he selected to be independent, get his own apartment, and particularly move into the Berkeley community. And of course, Berkeley is so physically structured for the disabled. It's probably the only community of its kind. Jeff has a great challenge in his particular physical situation. These things that we take for granted and that take us 15 minutes probably take him an hour and a half. Getting into the market, trying to reach for items on the shelf, which are so much more challenging for this young man who has great need to do this all by himself. And he's doing it. And he's doing it well. While he's in In an apartment, he has the use of a walker. Plus, he must have a helmet on in the event that he should fall because his balance is very poor. He doesn't have very good control over his legs. He has a tremendous hip involvement. So as far as getting around in the house, he gets around with difficulty. He's aware that dystonia is a disease that he has to live with, and he's learned how to cope with it. He's really so grateful that he has reached this point, and it didn't happen overnight. It took years because we were dressing Jeff, and we were feeding Jeff and bathing him. And less than 10 years later, he's living in his own apartment, doing things that, like I said, we take for granted, but they are tremendous. They're monumental accomplishments for him. I think that the future is going to be very productive. I know he's right now in a program with computers, and if there is an opportunity for him to make something for his future, he's going to do it. He has a tremendous drive, a tremendous need to accomplish and not be dependent on anybody. I think that's the key, this great need for independence.
Despite the fact that the disease can be progressive in some patients, it remains confined to the motor system. The intellect, the sensibility, the senses, hearing, seeing, thinking, are not affected at all in this disease. It's solely a disease of the motor system. In fact, it appears confined to one particular part of the brain concerned with the control of movement. The cause of Dystonia musculorum deformans is unfortunately not known. However, it is known that there is an unusually high familial incidence of the condition. And in fact, the condition appears to be peculiarly common amongst European Jews. The question as to whether or not it is hereditary obviously arises, and there is fairly strong indication that while most cases are isolated cases, Dystonia musculorum deformans can indeed be inherited on occasions.
How was school? Did you eat lunch?
Yeah.
All?
Yeah.
Do you have homework?
Yeah.
What? Reading?
Yeah.
You have written homework. Reading? Before I got married, I went to the doctor and asked about having children. And he said, have a dozen. So I had 2. My oldest, who is now 14, is physically healthy and normal. Lori, who is 11, has dystonia. Somebody made a mistake. If I had known, I would never have had children. The disease would have died with me. Okay? When you have dystonia, there are 2 ways to hopefully curb the disease. The first is with drugs. If nothing works for very long, And the disease is kind of progressing rapidly at its own speed, and you're no longer in control, if you ever were. As far as I'm concerned, there are no options. There's only one thing that will stop it, and that is a surgical procedure. Now, the surgical procedure happens to be on your brain.
This is Laurie Roberman. Today's date is March 23rd, 1977. Is Laurie taking medication at present?
No, she's not.
Would just give me a quick rundown on how old she was when you noticed the first symptom and what it was.
She was...
When I first saw Laurie, I guess I really wasn't prepared for what I was about to see. I knew that she...
Dr. Joseph Waltz is director of neurological surgery at St. Barnabas Hospital in New York. He is prominent in the surgical treatment of dystonia, having treated several hundred patients over the past 20 years.
Because here was Laurie, that sweet little girl, with dystonia generalized. She couldn't walk. Both lower extremities were involved. Dystonic posturing of both lower extremities. Severe spasms in her left leg. She couldn't use her hands functionally. Both involved more on the left than the right. Her body was twisted to the left. Her head was also pulled over to the left and back. But yet, that sweet smile was still there.
All right. Yeah, all right.
But I knew then that she was going to have surgery. The question was when. How long could we delay it? Because I had operated on children 8, 9, 10, yes, but 6.5, no. In total, I operated on Laurie 5 times.
I want you to count for me from 1 to 10 for me, okay?
1, 2, 3, 5, 6, 7, 8, 9, 10.
Good. All right. Hold your left hand
Yes.
out to the side.
It bothers me that in carrying out these procedures, we did lose some speech function. And I guess the best way one can look at this is that you are trading off one symptom for another. And I feel that, and many of the patients do also, that to stave off the severe progression of dystonia, which would be extremely debilitating in Laurie's case, to stave that off, return her to relatively normal motor function, we did give up some speech function. And I look at it myself in those terms, that if I had to give up speech to get motor function, I would do so. In other words, I would not ask a patient to lose something that I myself would not be willing to give up to achieve a therapeutic result.
Dr. Waltz recently has developed an alternative surgical procedure called spinal cord stimulation. In this procedure, an electrode is passed into an area near the spinal cord and implanted in the neck. When activated, the electrode transmits impulses to the brain in an attempt to regulate the control of motor function. Unlike brain surgery, spinal cord stimulation doesn't alter the physical structure of the brain itself, thereby reducing the risk of complications. The system is driven by a radio frequency transmitter, which the patient wears. It is designed so that a person can engage in normal activity.
I forget what setting I'm
Mark is 11.
Do what?
Before undergoing this procedure, he was confined to a wheelchair and could barely use his hands. Now he has almost full use of his hands, but still has difficulty walking. Though Mark's condition has improved, his future remains uncertain.
You didn't? Did you have gym today or anything?
Oh, yeah. Play touchdown again.
Did you?
What's that, football?
Did you win?
I don't play.
What was that team were you both?
There's stages you go through. You know, it's why me? How could you do this to me? What did I do to deserve this? My wife and I have resigned ourselves to the fact that there's not much more that can be done. So we're doing the best we can with what we have. The stimulator has taken away most of the pain, in fact, almost all of the pain. And he's progressively still getting worse, but there's no pain involved anymore, which we feel, you know, if that's what has to be, that's what has to be. I think he's adjusted to what he has better than we have. Well, it's going from a normal 8-year-old to it's tough to talk about.
The future for Dystonia, what I'm hoping for is that they clear the way for my children to have children, that they will discover something and develop test for it. Chloe is my buddy. She's my pal. She's also my strongest opponent. Right? And she's come to say goodnight because we're done filming and she has to go to bed. I know you have to brush. You have to say goodnight. You're going to say goodnight to all the people out there? No? All right. Say goodnight to me. Now, I'm here. Of course you can brush and wash, do the whole thing. You have a wet nose. I'll come right in, Lloyd.
Those who suffer from dystonia live with constant uncertainty, not knowing what strange new turn their unpredictable illness will take, or if they will ever be able to perform even simple tasks without monumental effort. But amidst the uncertainty and struggle is the sustaining hope that science will somehow unravel the mystery of this puzzling disorder, enabling them to regain control of their bodies and be freed from this twisted fate.